Hi guys, my name is Dr. Rob here at Dental by Design in Hammersmith. Today we had a patient called John. He came in and he had a unique situation where he had a massive underbite. So his lower teeth were overlapping his upper teeth. He had a lot of missing teeth. He wasn't confident in his smile, struggling to eat and digest his food. So if you just come over here, I'll just show you what the before looked like and how he presented to us. So this is where his lower teeth were overlapping his upper teeth. And you can see there quite a lot of missing teeth. We took our 3D X-rays and our intraoral scans and some photos, and we planned the case on our software. So we knew exactly where all of our implants were going. We constructed some 3D printed guides as well, which helped us place those implants where we planned them on the computer. After that, on the day of the surgery, we numbed him up, made sure he was super comfortable. We proceeded to remove the teeth. We placed our guides and we were able to drill the positions of the implants into the correct position. And then we took our records, we took our photogrammetry scans from iMetric. We sent that to our designer and our designer was able to design a new set of teeth. Ultimately, we managed to reverse his underbite and give him a normal, nice, beautiful smile, which we actually 3D printed on the day. So we're just slowly administering an anesthetic, very slowly. So John doesn't feel anything. All good, John? Mm-hmm. To numb up the lingual aspect, we start from the buccal and slowly make our way in between the teeth to numb up the inside, and that's how you can numb it up in a painless way. You feel a little bit of pressure, okay? Mm-hmm. So we elevate the gum off the bone. What I'm doing is I'm just lifting the gum, trying to look for the mental foramen. So just about see where my elevator is, where the exit of the nerve is. And then just about there. You just see the concave exit. So that's our boundary. You just have to avoid it. So this is the lower guide, bone supported guide. So this sits on the bone and we secure it with 4 pins, which we'll show you now. So we're placing the fixation pins to secure the guide, and we've got one more. Okay, John?
Okay, yeah? You feel any pain?
Yeah.
No, okay.
So we've got the bone supported guide. This kind of tells us where to remove the bone as per the plan. So that's what we're going to do now. So now we're using an osteodensification burr to just condense the bone. It spins in reverse and it just condenses the bone. John, all okay? Mm-hmm. Bone is very good, yeah? That's what I noticed. So that's what you want to avoid, yeah? So we just drill in front of it. The implants went in solid. And number 2, the bite is like 95% there. So now we're scanning the upper arch and the mouth, just to share with our technician any adjustments that need to be made before we move to the final. So we delivered his new smile. The whole process took about 5 hours from start to finish, and he will be coming back in a couple of weeks where we'll be able to see how everything's looking. Do we need to make any little adjustments before we proceed to the finals? So yeah, all in all, great day today. Patient was happy, I was very happy, everyone was very happy. So we look forward to fitting him and reviewing him in a couple of weeks' time. I'll see you soon.